Now, the South African Medical Association says the healthcare sector needs to prepare for significant reforms. SAMA is holding a briefing, or rather held a briefing, on the state of the country's healthcare ahead of its annual conference tomorrow. Newzroom Afrika's Katleho Sekhotho is at the Sandton Convention Centre and joins us now for more. Katleho, it's great to see you. Can you take us through what's said to be discussed at this conference, especially considering a whole range of issues facing the healthcare sector? Of course, one of them in the headlines recently is this issue of hundreds of unemployed doctors.
Certainly, Michelle. A very good afternoon. So the South African Medical Association gearing up for its annual conference, which kicks off tomorrow until Saturday. And following the comprehensive briefing, if you will, just a short while ago, a number of issues to be discussed at the conference, and certainly one of them being the plight of young doctors who remain unemployed. Certainly also on the agenda is the NHI bill, and just a number of issues affecting the healthcare system and the ways in which doctors are struggling to work. So I do have with me the chair of SAMA, Dr. Mzukwa, to give us more details ahead of the conference. I mean, Doctor, thank you for your time. Can you just take us briefly through the program of the next 3 days for the conference? What are the highlights? What are the key points?
Thank you very much for giving me this opportunity. The South African Medical Association is pleased to have this conference that has brought a variety of speakers from many aspects of the healthcare system. We are looking at strengthening the healthcare system. So there are many issues that will be touched. Some of them will be looking obviously on the governance issues, regulations. We'll be having the registrar of HPCSA, and we're also looking at policy issues that are really affecting, including NHI. Some of the aspects in the bill that we think need our attention. So it will take that form, but not only that. What we see, we want to speak obviously on the resources that we have. How do we efficiently use such resources in an equitable way? In our context, we talk about urban versus rural areas. So it is important that as a national association, we speak not only for the urban areas, but we speak for the rural areas, the poor settings, the indigent of our country. So we are excited that we've got these speakers that are really empowered to, inform our dialogue as we get into this conference.
And certainly, Doctor, on the NHI bill, I mean, one thing you noted in the briefing was that it's all good and well on paper, but the current systems that we have just wouldn't support the NHI. Just briefly outline your points there.
Yes, thank you so much. We, like you said, support the objectives of the bill. But now, if you have poor governance, leadership and governance, you have dilapidating infrastructure, you have shortages of healthcare workers who are the backbone of a healthcare system, and you have no medicines. There's many issues that we think we need to be ready for the system. The system must be made ready to accommodate the NHI. We've been told that the department is doing both the bill and also improvising the system. We have not seen such the other side where they are employing more, where they are improving the hospitals, looking at the infrastructure. So we want to see both things that are happening at the same time.
Yes. And Doctor, in terms of the urgent matter with the unemployed doctors, we saw over 800 doctors in KZN demonstrating. I mean, the solution there on a short-term basis, what does that look like?
Well, if you look at what we've got as the report from the World Health Organization, we've got a PHC, that primary health care, that can assist, to at least get about 90% of the universal health coverage interventions. So we believe that if those doctors are absorbed, we've got clinics that don't have doctors, we've got district hospitals that don't have doctors, many of these. So they can be populated in those areas so that the public healthcare system, which is used by 85% of the population, is well resourced in terms of human resource for health. So that those unemployed doctors, all of them can be absorbed still after absorbing those doctors, you still have a shortage of doctors. So we think it's an opportunity for the department to absorb those resources.
And now, in terms of the decriminalization of the medical sector, a number of litigations being brought against doctors, perhaps in some cases rightfully so. What's the stance by SAMA in terms of that framework?
Well, as the South African Medical Association, we believe that there should be a transparent platform that is not punitive. A platform that would make, if there's a mistake in the system or there's an adverse event, that is investigated, because the issue is not about the doctor was attending to the person or the child or whoever. It was the doctor working in a system where you've got a hospital, you've got nurses, you've got machinery, you've got all these things, even power shortages. So when there's an investigation in this, it must accommodate all these factors that affect the outcome of an operation. So we believe that there should be a platform that accommodates that, because at the moment, patients don't get the answers because the doctor is defensive, they are frustrated and stuff like that. So if we create an environment that is not punitive, but it does not mean that we must look away when there is negligence. No, there must be a balance where you find that, that patient is not left unattended because the doctor is saying you are litigating, so I'm not talking to you anymore. So it should be a process that is open, that allows, improvements of the system, because once we talk about the system and the inefficiencies, then we can be able to improve the system, because that system, that method would serve as an auditing process of some sort.
And I guess just another one, Doctor, in terms of your relationship with the health department and government as a whole, in terms of this conference coming up, is there any notable guests who will be part of the conversation to bridge that gap between yourselves and the state?
Well, we have invited the Department of Health. Is a very important stakeholder because they are implementing the law of the country and they are running the system. And we always say that they are not the Department of Public Health, they are Department of Health. It means private sector and the public sector. We've got their senior officials are coming to attend the conference. We also have the Minister of Health who has confirmed coming to the conference. So we believe that it will be a very fruitful engagement with that important stakeholder.
Thank you for your time. Thank you, Doctor. Michelle, you heard it there from Dr. Mzukwa, just explaining the process of the conference in the next few days, starting tomorrow and ending on Saturday, and lots of robust conversations. And as he's mentioned there, health being on board, and perhaps the minister also will be attending to iron out a number of issues as it relates to the NHI bill, unemployed doctors, and a number of policies and framework which govern the healthcare sector, and hopefully finding lasting solutions to the problems and the challenges in this particular sector.
Katleho, Sekhotho, thanks very much indeed for that update. And an incredibly important conference with a whole range of issues up for discussion.